I don't know what I'm supposed to be showing you, but it's not open. This is the area. This is the walls. My phone is gonna be on my water bottle. It's clear. There's nothing written on it. Move your hand. Oh, there's nothing. It's cleared. Okay, and I did get it signed. All signed. She checked. Okay.
All right, are we ready?
You're not reading questions, by the way.
What?
No.
Oh.
You can't pronounce unconscious.
I know.
You're not. I'm so nervous.
Okay, I'll read the question. I won't look at you.
Okay. Scary. Actually, you could choose one of the cards.
Okay. The first one.
Oh, syncope.
Oh.
All right.
Hold on, let's show her.
Yeah. Syncope.
Do.
Okay. I'm looking at syncope. I'm actually shaking now. All right. Is the cause of syncope too much blood to the brain or too little to the brain? Too little. When a patient is stressed, which part of the nervous system causes the blood vessels to the skeletal muscles of the arms and legs to dilate? The sympathetic. What is the most common cause of syncope? Stress. What are the early signs and symptoms that warn us that our patient is about to faint? Paleness, dizziness, nausea, cold sweats, and hot. What initially happens to a patient's BP and pulse who is stressed or scared? It increases once our patient has fainted and become unconscious. What will happen to their BP, pulse, and respirations? It'll drop, which is why they fainted. Is it possible for a patient who has fainted to go into convulsions? Yes. What is the very first thing you should do when your patient faints? Call code blue. What 4 things should you send one of your classmates for during an emergency? You want emergency kit, emergency clipboard, AED, and oxygen. What position should a patient who has fainted be placed in and why? You want the Trendelenburg position, and that'll help their venous go to their heart. Okay. Which patient that has fainted should we not place in a Trendelenburg position? Pregnant. How often should we take pulse, BP, respiration during an emergency? Every 5 minutes. Why would we wave an ammonia capsule under our patient's nose who has fainted? Excuse me. To stimulate muscle movement and breathing. Why would we, I read that one. Should we give oxygen to a patient who has fainted? Yes. How much? 5 to 6 liters per minute. Where should you document everything? You would want that in the record of treatment and the medical emergency report form. If your patient has an emergency, where should you remain until it's resolved? Do you want to remain with the patient or until it has resolved or until EMS has arrived? What is the number 1 thing you can do to prevent an emergency? It is take a good medical history. All right, we got syncope. We're moving on. Pick another one.
Oh, hyperventilation.
Hyperventilation. All right. There are no notes on it. Ooh, oh no, envelope stuck.
Oh god.
Oh my gosh. Okay. We were making jokes about how I was gonna have a voice in this. I don't know if I will, but we'll see. Does respiration increase or decrease when a patient is hyperventilating? It increases. Which patient is most likely to hyperventilate, a child or an adult? An adult. What stimulates the breathing reflex in normal, healthy patients? Increase in carbon dioxide. Yeah. When a patient begins to hyperventilate, what do they exhale large amounts of? Oxygen. Yeah, so that's why, yeah. If not treated, what will happen to a patient who is hyperventilating? They can pass out. When a patient is hyperventilating, which becomes low, their blood oxygen level or their blood carbon dioxide level? Which one becomes low? The carbon dioxide. What caused a patient to hyperventilate? Nervousness, stress, anxiety. What are some of the signs and symptoms of a patient who is hyperventilating? Gasping for air, paleness, shallow, and deep breaths. What four things do you send your classmate to get? Emergency kit, emergency clipboard, AED, and oxygen. What is the position you should have them in? You want them upright, supine. That'll help them breathe, make it easier for them to breathe. How much oxygen should be given to a patient who's hyperventilating? You want to, how much? Hyperventilating? Did I miss a question? Hyperventilating was the one where we don't give them oxygen because of the carbon dioxide. What do you lose? Oxygen. Oh, no. Yeah, never mind. 5 to 6 liters per minute, not milligrams. Liters per minute. How often should we take pulse, BP, and respirations during an emergency? Every 5 minutes. What drug could help prevent Valium? What would you instruct your patient to breathe? How would you instruct your patient to breathe who is hyperventilating? You want to either get a paper bag or cup your hands like this, and you're gonna have them inhale and hold that for 5 to 10 seconds. What is the dose of Valium? 10 milligrams an hour before they come in. Where should you document everything? You want it on the record of treatment, the medical emergency report form. Where should you remain until resolved? With the patient until resolved or until EMS has arrived. What is the number one thing you can do to prevent an emergency? And that would be take a good medical history.
Next.
Yes, ma'am. Next.
Asthma.
Okay. Does asthma cause the bronchioles of the lungs to constrict or dilate? It causes them to constrict. Does asthma increase or decrease mucus production within the bronchioles of the lungs? It increases it. What are some of the allergens that can stimulate an asthma attack? Normal everyday life, pollen, animal dander, dust. If you were in a dental office, it could be latex or impression material. Can stress of a dental office cause an asthmatic attack? Yes, it can. What effect does an asthmatic attack have on BP and pulse? It increases it. Name a common drug used to treat an asthmatic attack. A goes with albuterol. Does an asthmatic typically have more trouble inhaling or exhaling? Actually, exhaling. I thought it was inhaling at first, but it is exhaling. What is the very first thing you should do when your patient has an asthma attack? Code blue. What 4 things should you send one of your classmates for? The 4 things: emergency kit, emergency clipboard, AED, and oxygen. What position should a patient who is having an asthmatic attack be placed in and why? You want them upright in that supine position again, so it's easier for them to breathe. May we give oxygen to a patient who is having an asthmatic attack? Yes, and how much would we give it? Would we give 5 to 6, I want to keep saying milliliters, but it's liters per minute. How often should we take pulse, BP, and respirations during an emergency? You want to take it every 5 minutes. You don't only give it for 5 minutes, you're going to take it every 5 minutes. If your patient indicates a history of asthma, what questions are you going to ask them? How often do you get it? What stimulates it? And what helps relieve it? Can exercise stimulate an asthmatic attack? Yes, it can. My friend had it. What are common symptoms of a patient who is having an asthmatic attack? They're going to also struggling to breathe, maybe wheezing, definitely going to turn pale. What are common symptoms? Oh, not that one. Where should you document everything? Again, on the report. You're on the record of treatment, medical emergency report form, and then where should you remain until the emergency situation has been completely resolved with the patient, until it's completely resolved or until EMS arrives. What is the number one thing you can do to prevent the emergency? Taking good medical history. What's the last one?
Let's show up. Airway obstruction. Here we go.
Last one. Okay. Oh, I forgot to show you. There's nothing on them, I promise. So what is the flap of tissue that prevents foreign objects from entering into the larynx? It is the epiglottis. How can you distinguish between a partial airway obstruction and a complete airway obstruction? The easiest way is if they can cough or speak, that would be partial. If they cannot speak or they are barely even coughing, like a very, very forceful cough, then that would be a complete airway. They can't breathe. It's completely obstructed. If a patient is deprived of oxygen for 4 to 6 minutes, what is likely to occur? They're going to pass out. They're going to go unconscious because they can't breathe. What are the symptoms of a complete airway obstruction? A complete can't breathe, pale, symptoms. Okay, I almost thought it was signs too. So they can't breathe, they're gonna go pale, they can't talk, they're gonna be grabbing at their throat, and what is it? They probably will be trying to forcibly cough. Can a patient lose consciousness as a result of an airway obstruction? Yes. If an airway obstruction should occur with your patient, what's the first thing you do? Call code blue. What 4 things should you send a nearby classmate for in the event of an airway obstruction? You want to get the emergency clipboard, the emergency kit, AED, and oxygen. If your patient has an airway obstruction, but they can still cough, how would you try to do the Heimlich procedure on them? But they can still cough. Would you? I keep saying how. No, if they can cough and or speak, you should not do the Heimlich procedure on them. My gosh, I'm misreading left and right. Okay, where do you place your fist when doing the Heimlich procedure on a non-pregnant person who is conscious? So if they're conscious and they're not pregnant, you're going to place between the xiphoid process and the navel, and you're going to, it just says where do you place. If your patient loses consciousness while you are doing the Heimlich procedure, what should you do first? Call 911. Do we do finger slips on conscious patients? No. Describe the Heimlich procedure for a conscious, non-pregnant patient. Okay, here we go. So, hey, I'm going to go behind you now. I'm going to press my thumb with balled in a fist in between your belly button and sternum, because they don't know the xiphoid process in the navel. I'm going to go and cover it with my other arm. I'm going to wrap my arms around you. I'm going to go inward and upward with my movement, and I'm going to keep repeating until you can either dislodge it by me pushing that air out, or until you go unconscious. Describe the procedure for treating an unconscious, non-pregnant patient who has a complete airway obstruction. They're unconscious, so they're going to be laying on the ground. You're going to give CPR, which is the 30 compressions, and you're going to do your 2 breaths, you're gonna check for visible objects, and that's when you would do a finger sweep. I think you had mentioned that time of checking sometimes is wasted, so just doing the 30 compressions in the 2 air, the 2 breaths is best. But you should always check to see if there's anything visible. Describe the procedure for treating a conscious pregnant patient who has complete airway obstruction. You're gonna go above the xiphoid process. Again, I'm gonna be behind you, ma'am, because you're pregnant. I don't know if a man can get pregnant or not. I'm gonna put my thumb with balled up in a fist. I'm gonna put it on your sternum. It's kind of between your boobs. That's where you get that sternum tattoo. And I'm gonna put my my hand over your other fist, and I'm gonna go in inward upward motion until you can until it moves or you go unconscious. Now, for an unconscious pregnant patient, they're not going to be laying flat on the ground. You're going to have them supine, and you want to give them 30 compressions right where you had your fist between their boobs on that sternum area, and you want to give them 30 compressions, the 2 breaths, and also check for any visible objects and remove with a finger sweep. Where should you document everything that occurs during an emergency? The medical emergency report form and the record of treatment. If your patient has an emergency, where should you remain until the emergency situation is completely resolved with the patient, until it's completely resolved, or until EMS arrives? What is the number 1 thing you can do to prevent an emergency? Take a good medical history. Okay, just a quick side note. You would not give the person hyperventilating oxygen. What stimulates the breathing reflex in normal healthy patients? The amount of carbon dioxide in you. When a patient begins to hyperventilate, what do they exhale large amounts of? Carbon dioxide. So they are getting rid of carbon dioxide. When a patient is hyperventilating, which becomes low? Their blood carbon dioxide level, meaning they need carbon dioxide. When they are hyperventilating, you do not give them oxygen. You can give them oxygen during syncope or asthma, but you're not going to be giving them oxygen when they're hyperventilating. So yeah. I showed it to her already.
Oh, but I just gotta make sure she's done. So, we're done.